We expect that as we get these test kits out to state labs and as they get up to speed, some of the backlog that they've had on testing will go away, and we'll see a big bump in the number of cases. That doesn't reflect transmission as much as it reflects that we're catching up with the testing. In terms of the ages of cases, the median age is 16 years with a range of 3 months to 81 years. There have been 35 known hospitalizations or confirmed hospitalizations with 1 death. 62% of the United States cases, the confirmed cases, are under 18 years of age. The World Health Organization earlier today was reporting 1,124 cases in 21 countries. We're hearing from Mexico that they are seeing a plateauing in the number of cases there. We are seeing and expect to continue to see virus transmission both around the United States and around the globe. And we would expect that we'll see cases in all states over time. And given what we know from seasonal flu, we would expect that we would continue to see additional hospitalizations, and it's likely that we would see additional deaths. In the news, we've been hearing, and as we've been talking to our public health colleagues, we've been understanding what's going on in various parts of the country. In New York City, where they've reopened the school that had the large outbreak, and that's very good news there. So what are we seeing? We're seeing some encouraging signs. Again, the theme is this is a rapidly changing situation. If you think back over the past 4 days, where we were Friday and where we were Tuesday, we've seen an exponential growth in our understanding of what's going on. But we're still in that period of major uncertainty. We can look back and understand what's taken place, but where this is going to go is hard to say. So some of the encouraging signs, as we've talked about, we have some information about the virus that shows it does not contain some of the factors that are associated or were associated with some previous pandemics. We continue to gain information about severity in this country. And what we're seeing is severity that mirrors what we've tended to see with seasonal flu. And that's not to diminish the impact of seasonal flu. As the Secretary was saying, there's major burden on people's health from the flu each year. As we go forward, we are continuing to support state and local public health. We have deployed 86 people from CDC around the country as well as in Mexico. We have 16 people in Mexico working with the Mexican and Canadian team that is there. And that is continuing to shed light on what we are seeing in this country. As we learn more in Mexico, some of the things that looked different at the beginning are no longer looking so different. We're seeing more cases in Mexico of the milder disease, and that helps put in perspective what the initial reports were coming out of Mexico of very severe disease there. The Secretary mentioned the guidance that will be coming, and it will be posted later today around school closure, and I'll be happy to take questions on that later. The WHO has us at level 5, and as we've talked about each day, they are looking to see on an ongoing basis whether there is sustained transmission in any area outside of the North American region. That would be the indication that would lead them to consider whether there should be a change. And so it's not so much the number of countries, but whether the virus sets up shop in any of those countries like it has here and starts to spread person to person. And given the number of countries that have cases, one would think that eventually that criteria would be met. So in closing, as we go forward, we're going to be paying much attention to what takes place in the Southern Hemisphere. They're entering their flu season, and that will be very important as we think about what we want to do in this country in terms of vaccination. That information will be important in terms of looking at whether any resistance develops in the virus and whether the virus changes over time into something that would be more severe. the points about personal preparedness are so important, and personal responsibility. The change in the school closure guidance reflects our increased understanding about transmission, in that we're seeing widespread cases, in terms of severity, that we're not seeing the most severe strains that we were initially concerned about. And that is leading us to these change. It does not change the importance of personal responsibility in terms of hand washing, in terms of alcohol gels if you don't have use of soap and water, in terms of staying home if you're sick from work for a good 7 days, and keeping your children out of school if they're sick for a good 7 days. Those measures that can be taken by everybody will help reduce the likelihood that individual people will get sick, and if they're sick, that they'll transmit it to others. So I'm going to stop there, and we'll take questions. Secretary Sebelius will not be able to stay long, so if there were particular questions in that direction that we could get to first, we'll start here in the room.
Thank you. Secretary Sebelius, with respect to the question on the vaccine production, I want to flip the question around. How can you not go forward with production? And I say that in light of the time crunch that you're now up against. You know that you have a novel influenza strain in this country right now. Perhaps nothing will happen with it next winter and it'll go away. But if it returns with a vengeance and you don't have vaccine available, how can you possibly explain that to the American public?
Well, I think that, Cece, the goal is really to move forward, but I wanted to clarify. There are lots of people who have mistakenly believed that there is a vaccine available right now. I think there's been some confusion between the antiviral discussion with Tamiflu and Relenza and a vaccine. So I wanted to particularly clarify that there is not a vaccine. The development phase is very much underway, and I think that every effort will be made to make sure that if and when the call is made by the scientists, that production is ready to go by flu season. The fall is the target. But again, in this disease from the outbreak, the science has led the decision making. And so we're going to be turning to the scientists at NIH and here at CDC to say, is this next step what's recommended? Do we have a vaccine which can inoculate people in the future against H1N1? If so, who are the target groups to receive that vaccine? And I just wanted to make it clear that those decisions won't be made until there is a vaccine ready to go, and we'll turn to the scientists and make the next step based on their recommendation.